Welcome, welcome. This is the Coronavirus Central Florida podcast. I'm Maria.
And I'm Melissa. Thank you for joining us. It is mid-May already, and our numbers are continuing to climb. We currently have 45,208 cases today and 1,997 deaths here in Florida. And when I looked back, just comparing that to yesterday, that's up 1,600 cases just in one day and 10,000 cases in the last couple of weeks.
Yeah, I'm concerned about the numbers. I think that they're going to continue to rise and explanations are going to vary. For example, today, Governor DeSantis did say that 400 cases overnight in Miami were due to 90% of those 400 cases being backlogged 3 weeks ago, and they're just being reported now. So, it just kind of makes me question the numbers, the reliability. I'm a little suspicious about everything now.
Right. And rightfully so. But I think that the numbers are continuing to climb. I just don't think people are getting tested as much as they were in the beginning, or that they were trying to in the beginning. And I will tell you, I went out today after work and I went to a pet store, I'll just say that. And the employees were not wearing masks. And finally, I found one employee that was wearing a mask. And I said, and he was the manager. I said, why are your employees not wearing masks? And he said, it's optional. So it's optional, but they're opting out to not wear masks. I was blown away. I was blown away.
Yeah, especially now with the state opening, there are so many people out and about, more so than 2 weeks ago, for example. So I know that in our last episode, we started to review some of the things that are opening up. And as of today, we have opened the state even more. So we have fully opened phase 1, which means that restaurants and food establishments are able to have indoor capacity up to 50%. Whereas last week it was 25%. So this is new. And outdoor seating is not limited as long as tables are at least 6 feet apart. Retail open up to 50% capacity. A lot of stores haven't opened yet. A lot of restaurants haven't opened yet. And I know you had talked to us last time about elective surgeries. Have you seen anything new regarding that?
For our facility, we've picked up with our elective procedures, and I've heard of other facilities are doing the same. And again, it's relying on the PPE, and I think that multiple facilities are getting their PPE in, and so they're able to start resuming those procedures. So yeah, it looks like that's moving forward, and which is a great thing because a lot of patients are very happy with that. But gyms are opening up today as well, and
barbershops, salons.
Yeah. I have a gym membership, and I almost went in there today. I literally drove by because it was right next door to the pet store that I went into. And I wanted to go in and say, look, I'm going to put my membership on hold. But I couldn't go in there. There was too many people in there, and nobody was in there with a mask on because they're working out.
Right.
I just couldn't do it. I just couldn't bring myself to go into the gym. I can't say the name of the gym. I don't want to call them out, but it's all gyms that are open right now. So
yeah, and they're just relying on the folks working out to self-clean after themselves.
Yes.
So I don't know. I think I'm not going to be going to the gym either anytime soon.
Right. To sanitize. There's nobody following anybody around to sanitize these different pieces of equipment. And you hop from one to another. To me, it's a cesspool. I'm sorry.
And you're sweating.
It's nasty. It's not good. It's not a good idea. But power to the people who are in there, and I hope that I just wish you the best. I don't know what else to say. But one thing I've also noticed is that a lot of places have the plexiglass set up, but it's amazing how people are drawn to kind of go around it and talk around it because it's like a barrier. It's a natural reaction, but it's avoiding the purpose. It's there for a reason. So, stand behind it and don't, go around it to talk to people. I don't know. Scary.
Slowly. We should be moving slowly towards
Yeah.
this, but we'll see. We'll see. Those numbers are going up quickly. We'll, keep monitoring them and see how they continue to progress.
Yeah, I know that theaters are staying closed and bars and clubs are still staying closed. And my understanding is that the gyms in some of the counties aren't opening up, actually, like Miami-Dade, Broward. I don't think that they're allowed to open up just yet. But I think their restaurants are opening up. So, but
Yeah,
here
and
in, I'm sorry, go
I,
ahead.
I think ultimately local government has a lot of say as well. So, I think that certain businesses, if their local government says, let's not open just yet, they can do that. So I think, they have the ability to open up as much as the governor says for the state, but it's not completely mandatory.
Right. And the theme parks, I know they've been a request has been sent out for them to submit their reopening plan.
Mhm.
And so looks like they're trying to move that forward as well, which I understand that's, people think of Orlando, they think of our theme parks here, and that's what they want to come down here to enjoy. But yeah, that's a job right there to maintain a safe distancing and how many people can actually ride the ride. And do you really want to have people every 6 feet, on a ride? I don't know. I'm curious to see how that works out. I'm really eager to see how they come up with and formulate a good plan for that.
Yeah. Vacation rentals also, it's up to the counties. They do have to seek approval, by submitting a written request. So we'll see how that progresses too. Obviously, it's all hand in hand with tourism and hospitality and, the bloodline of Florida business. So we'll see how things, progress. I do know that I have some acquaintances who this weekend spent the weekend at a hotel in St. Augustine. It was like a staycation, and off they went. And there were lots of people at the hotel having a staycation. So, yeah.
So professional sports venues, Florida says welcome professional sports venues. So that's back on, I guess, ASAP, I guess as of today, because that's
Yeah.
the part of the completion of the full phase one. So that in long-term care facilities, the visitation is still prohibited. And the hospitals are supposed to be COVID testing all patients that move from a hospital into a long-term care facility. And I know that we've had some patients that are from like an adult living facility and they're still on lockdown. So their options to do stuff, unless it's like emergent cases, then they're not doing that stuff just yet. So
Right. Which is good. I mean, we have to protect our population that is at most risk.
right. Smart, definitely, because everyone wants to go cuddle up with their loved ones. I mean, if my mom and dad were closer, I'd be like hugging and loving up on them. But lucky for them, they have some distance from me. So, but yeah, people want to be around their loved ones. It's just hard.
Yeah.
Disney Springs is partially opening up as well as of Wednesday. So
Yeah. I had some friends celebrate a birthday and they went, and there were people there. I was surprised. There were, more people than I expected on their photos. But I mean, I think a lot of folks are just, they have cabin fever. They're ready to
right.
get out. Maybe they don't know anybody immediately close to them that has COVID-19, or, no friends. And so maybe they're also doubtful about how serious, how contagious COVID-19 is. And I think overall, as a community, we may be losing, sight on the fact that it is still a pandemic.
Right. And it makes me nervous when I go in. And one of the individuals that I seen in the store today was a police officer. I was just like, all people, because they're a first responder, they should know and understand why it's important to be wearing a mask. But
They
that
should
guy was
be
not.
they should be setting an example to
Exactly.
others, being a good example to the rest of the community.
Right. And that particular individual was not. It was just like, I wanted to be like doing this. But I didn't want him to be like waiting for me to give me a ticket when I left either. So I behaved myself. Let's see. But yeah, with Disney, I guess the restaurants had opened up early, but the stores, I guess, are what's They're doing cashless, contactless, the disposable menus, things like that. So
I've seen all kinds of creative ideas too. I've seen some restaurants that have put clear vinyl shower curtains between tables. And so their idea, yeah, their idea is that they're going to, Lysol or just uh, clean the shower curtains between, customers. And I don't know if I really want to sit in a shower type environment.
no, eating in a bathroom is just not my ideal of a nice formal way of dining. So
Right, right. But we'll see. Let's progress.
um, did you have anything else on the finishing of the full opening of phase 1? Do you have anything
No,
else you want to?
I think that's basically it,
Okay.
just to reiterate the fact that I know nobody wants to be locked in.
Mm-mm.
Nobody wants to be prohibited from going and having dinner or a cocktail or hanging out with their friends and family members. It's
Right.
not, we're not doing this for fun.
And wearing a mask is not for fun either. Trust me, my face says no.
Yeah, yeah.
So,
So, but I think it's just a matter of being responsible citizens and,
right.
doing this not just for yourself, but you're staying home for your mother or your grandfather,
Right.
whatever. So, you're doing this for your loved ones.
Right. But I say, I vote for love a stranger, love the people you don't even know and protect them just as much, because it's amazing how it's really a small world. And so even though you may not feel like, regardless of whether you know them or not, I mean, you should be thoughtful of those people and try to protect
Absolutely.
them.
And
These
I know that
numbers are astronomical. I mean, if you break it down, I mean, a person's dying, more than one person an hour is dying here in Florida alone from
we know
COVID
it.
that we know of. Right. It probably could be twice that, honestly.
Right.
That's
right.
too much.
It is. And a lot of those are unnecessary.
Right.
They could have been prevented. And I think that a lot of folks think, hey, I'm in my 30s, I'm in my 20s or 40s, I'm
Right.
young. This is just going to be like a cold or the flu. And even though a lot of folks within, those age groups are surviving, they're not having an easy time with COVID-19. Some people are getting amputations. Some folks are getting strokes. It's not it's not a cold, so it's not something you should try to get or not care about getting.
Right. And, they were saying, I was listening to, I can't recall exactly where I'd heard this from, but they were talking about, it's pretty obvious that the numbers, it's more women than men that are wearing masks. Now, I've seen a lot of men. So to back you men out there, I have seen lots of men wearing masks.
Sure.
And I know yours wears a mask. But in saying that, the numbers, like when I am out though, and I do compare a little bit once I've heard this, okay, yeah, there's a lot more men out there not wearing masks than the women. So I'm going to say this to you guys. So you're halfway through the game, right? And you're up by 6. Okay, let's play basketball for a second. And you're up by 6. Do you quit then? Or do you continue to play hard so you can win the game with a big score? Get your head in the game, guys. Wear a mask. We need your support and we want to win and we need you on our team. So
some women might think it's sexy.
It's a new fashion statement,
yes,
right?
Exactly. Plus it shows that you're responsible, et cetera, et cetera. So
right. And look at my cute new mask,
Exactly.
So this month is Mental Health Awareness Month. So I've come up with some resources for our listeners because this has been such a challenging time. And I really just wanted to kind of put that out there. And mental health is also, I find it a little frustrating sometimes because it's expensive. So if you want to go get counseling, or if you want to go see a therapist, insurance doesn't always pick that up and help you. And so I really did some digging. I found some decent resources here I want to share with everybody. Talkspace. Talkspace has reached out and done, it's free therapist-led Facebook support groups. And it's 16 days of anxiety relief program that they're providing to help manage COVID fears. And then they're giving 2,100 free months of a donation. It's a donation program for healthcare professionals and first responders as well. How they're breaking that up, I guess it's as people sign up, you're taking up those times, those free donated months. But still, even if it's a group therapy, it's something. Something's better than nothing, and that's free. NAMI, which is the National Alliance on Mental Illness. I'm going to give out some numbers here, so guys, grab a pen and paper if you need to. It's 1-800-950-NAMI, N-A-M-I, which is 1-800-950-6264. And they are open Monday through Friday, 10 to 6, and that's free services through them. 7 Cups of Tea is offering free emotional support. It's a peer listener and chat group as well, but they can offer professional therapists at a low cost right now. They're offering that, but the chat group is free. And then the Center for Interactive Mental Health Solutions, they're offering 8 sessions free for depression right now. So some good resources there if you need it. You're not alone. So everyone's going through different phases of this, and some people are struggling more than others, and depression's very real. If you're having a hard time, it's okay to reach out and ask for help. So even if it's in a group setting, because you're amongst friends, so reach out and utilize those free services.
Great. And, I'll also add Florida Medicaid. Florida Medicaid is always there. And let me read a little bit about some of the requirements. If you are over age 64, if you're pregnant, if you have a child under 18, if you are blind or disabled, or have a child, parent, or spouse who is blind or disabled, you may qualify. There are some financial requirements. So go on their website to apply and find out more. It is benefits.gov/benefit/1625. So benefits.gov, benefit/benefit/1625. And a lot of people, now that they're furloughed or laid off, they don't have any medical insurance. So with Florida Medicaid, it covers a lot for you and your family. So if you qualify, please be sure to apply for that.
Yeah, and I've actually spoken with a friend of mine here in the local area, and I was amazed that his parents had not signed up for Medicare. And they both had hit the age limit, they both had hit the qualifications for it, and had not signed up for Medicare, but did not have health insurance. And I was like, do it today. So I'm like shooting. So look up those different resources, and just, Melissa, on random thought, I'm going to throw something else out just because you'd said that. When it comes to medications, it's a huge pet peeve of mine. They're so flippin' expensive. It drives me crazy. And a lot of people spend so much money on medications, but they can't afford it because they're low income. And it's a huge struggle. When you have a medication that you're supposed to be taking all the time, look into that drug company. And a lot of times they have programs for you. And you'd be amazed if you're paying $800, which I know some of these scripts are a month. If you're paying that much money and you're having a hardship, reach out to that pharmaceutical company and see if they have a program, because you might go to not paying anything for that medication, or a small $20, $30 a month. And when you go from $800 to $30 a month, you can thank me later. I'm telling you, it's huge. But it drives me a little bit crazy, because medication that people need like that should not be that expensive. So by all means, advocate for yourself and do some research and see where you can cut some costs there to save y'all some money.
Yeah, and never hurts. You never know who's going to offer you resources, or, your landlord. It doesn't matter. If you need help, ask for it.
Yeah.
Speaking about financial hardships, I know that a lot of folks have not received their stimulus money yet. I know we have gone over that in detail. But just to review a little bit, if you make $75,000 or less and you're a single income filer, then you would possibly qualify for the $1,200 stimulus money. That will be automatically deposited to your bank account if that is the way you set up your taxes when you filed either this year or 2018. If you are filing married jointly, then the max you can make income-wise is 150,000, and you would qualify for 2,400 and $500 per qualifying child. So that's unto age 17. You would get 500 per child. And in order to find out what the status is of your stimulus money, go to irs.gov, click on the button that says get my payment, and it might just ask you, like your social, your birthday, your address. I think that's basically it, and it'll give you an update. It might say, hey, it's in the works. It's going to be deposited to bank account ending in these 4 digits, or it might say, hey, we need your bank information, or we need whatever information they need. So irs.gov, I would never say enter your bank information. However, it is an official governmental website, irs.gov. Make sure you're on that website, and find out the status, if you haven't received it yet. So good luck to everybody, on getting that.
Yeah, you say bank account and entered. I'm like, scary. But if you trust the site and you trust who you're working with, then okay. Not to backtrack, but I want to talk a little bit, being a mother. I really think about, the symptoms with kids and if it's the same or not. And I've kind of been watching mine, like a little overly paranoid, kind of like, is that maybe a symptom, And so I did some research, and I've also heard some information that's come out about some new symptoms, some new signs and symptoms of COVID-19 in children. And some of these patients are presenting with like Kawasaki disease. It's the similar things that they're presenting with, which is a fever of 105 101 or greater for 5 days or more, and a rash, red eyes, swollen glands around the neck, and some hyperinflammation. So if you see any of that going on with your kiddos, straight to the doctor with them, because you don't want to delay. Go ahead and take them in. And this is symptoms that can be treated. They know Kawasaki disease is complicated, and that's a whole different conversation. But, they do know how to treat it. So go ahead and take your little kiddos in. If you start seeing any of those symptoms, 101 fever for 5 days or more, I don't know, this mama would already be flipping out just a little bit. Nurse or not, like I would still be overly concerned and be having my kiddo looked at. So, and again, look at their color. To me, the color is very important. If a kid looks, like they're a little bluish, or they're just not themselves, keep an eye on that and make sure that they're breathing well, they're breathing as good as well. So
I know that a lot of stats were saying that children are not susceptible to COVID-19, but I think that we're slowly seeing that children are getting very unusual symptoms.
Yeah.
So don't, like Melissa said, if you see something doubtful, questionable, worrisome, take them in.
Yeah. I mean, we talked last week about the patients who were coming in and their oxygen saturations are like, you would be wanting to intubate these patients and like getting an airway secured, and no, they're walkie-talkie patients. They're talking to you. Like, it's not what you would expect. So it's creepy. This is again a very tricky devil. This little booger is a devil, and it plays on each person differently. So anything out of the ordinary, GI symptoms has been a big thing lately that they're looking at. Really, some weird GI symptoms, go get tested. What's it going to hurt? It's free. Go get tested.
Oh, and I
And
will say, I never mentioned it, but a few weeks ago, I did get tested. Wasn't feeling too well. So I went in and I went through the entire process. It was a drive-through at UCF here, local. And easy peasy. There was absolutely no one in front of me, no one behind me. So I was the only person there. So there was no wait. I stayed in my car, and a nurse came up and did the swab test. And that was not fun. I will admit, it was not fun. I was not prepared for quite that extreme or extensive of a swab test. I mean, it wasn't a regular, I don't even, I'm still a little traumatized from that experience, but it took, a couple minutes from start to ending. I was out of UCF and I had my results in the next couple of days, negative. But I'm glad I went through that experience. And again, it was super simple. And if you feel you have any symptoms whatsoever, please go ahead and get tested.
all right. So I want to introduce everybody. This is Jay. He's adamant to be on my lap. So we have an active participant here with us today. So, but yeah, I remember you talking to me about going through that drive-through and how that experience was for you. But honestly, the deeper and, more that they get in there, the more accurate the test is going to be. And because if they barely get in there, then you're going to possibly have.
He could have checked for my IQ score. He was like massaging my brain with that swab. It was horrible.
Oh my gosh, you're so funny.
I needed a moment to like gather myself before I could drive away. It was, but it was necessary. I had doubts, and I needed to get some results, and I did, and good results. But oh Lord,
memories. Just they go down in the books as memories, right?
Yeah.
Well, I think that's pretty much all I have. Did you have anything else for today?
I had a Toasted Restaurant mentioned here. They are located in UCF area, Lake Nona, Winter Park, and Windermere. And Toasted Restaurant, they specialize in toast cheese. What is it? I don't even.
Like a flatbread or?
No, it's literally, toast with melted cheese.
Like, I want to say like bruschetta or something like that, but no, that's not what you're talking about.
No, literally, like if your kids want just toast with cheddar or whatever, and you just melt it. It's so basic. I don't even know what the name of it's.
It's just like garlic cheese toast.
No,
sorry, y'all. She's a foodie. She just can't help it.
So basic. I don't even. Okay. Anyway, so Toasted Restaurant. I haven't. Okay. However, I heard it's really fun. And they are giving free kids meals Monday through Friday until school ends from 11 a.m. until 2 p.m. to all students. And again, they are located at UCF, Lake Nona, Winter Park, Windermere. So if you have a child, go. And if you have a need specifically, especially, go. Or if you know anybody that has a need, please let them know. So thank you, Toasted Restaurant.
Fabulous, fabulous. All right. Well,
that's it. Just to thank our wonderful audience members for listening. Also, please be sure to hit the red subscribe button in our YouTube page. We really need the support. All the support, the better. And you can also hit the little alarm bell icon to notify you when we have new videos downloaded. If you follow us in iTunes or Spreaker, please also let them know what you think about how wonderful we're doing. Leave a commentary or a review. The more reviews, the better for us. So, thank you so much for your support, everybody.
Yes. Well, thank you all for joining us. My name is Melissa.
And I'm Maria, and this has been another episode of the Coronavirus Central Florida podcast. Have a lovely evening.